Today, we not only want to celebrate the achievement of women in our community, but discuss her contribution specifically to research on a topic that impacts us directly. We're joined by Boulder-based health journalist and author Megan Rabbit. Megan, congratulations, has recently published a book called The New Rules of Women's Health. We are so excited for you to be here. Tell us about this book. How does one come to do this research, get in this field, and then write a book?
Yeah, so I've been a health journalist for going on 25 years now. So I've really dedicated my career to helping women understand our bodies and talking to doctors and researchers to help translate what often feels like medical jargon and a lot of information into actionable steps. And actually, Maria Shriver asked me to write this book for her imprint at Penguin Random House. Yep, I'm honored to work for her at her newsletter. And she said, Megan, I want you to write a book. I want it to be on women's health. I want it to be a manifesto.
High praise.
Yeah.
What have you seen as some of the biggest changes? You've been following, women's health for decades. I would imagine things have changed significantly.
Yeah, and thankfully they have, because for years we were not studying women in our own right? We were looking at male research and applying it to women. And what we now know is that that's not good enough. We really need to study women. And here's a shocker. It wasn't until 1993 that the National Institutes of Health demanded women be included in research. I was a freshman in high school at that time, so that's really recent, and we've got a lot of work to do, but luckily we're starting to make right changes.
Gosh, when you say that, it makes so much sense why, I have friends dealing with perimenopause or fibroids and things. I'm like, I have never heard of those things even 5, 6, 7 years ago. It's unbelievable.
Yeah, I mean, and to your point, it wasn't until 2012 that the NIH launched a gynecologic branch to study conditions like endometriosis and fibroids. So no wonder we're asking our doctors, why do I have fibroids? And they're like, I wish I could tell you why. We just haven't done the research or enough of it.
Time to do the research for sure.
Yeah.
What are the new rules? What does that look like?
Yeah, there are so many, and they span every health aspect, right? But let's say overarching, it's really time for us to own our health. We have to become our own best advocates. And so really that starts with education. It's educating ourselves about the various things that can happen to us, educating ourselves about what's normal and what's not, so that we know to raise a red flag with our doctors about, let's say menstrual health issues, know when to bring up the right questions. And then I think another big new rule is to hire the right team. Think of your healthcare like you're the CEO of your own healthcare. And that means hiring the right doctors, firing ones who don't listen to you. And I think we really have to take ownership in that way.
Gosh, so you can say be your own advocate, but you really have to at all. Have you ever had a situation that you've had to step in and kind of, take the reins?
Yeah, I mean, I have had a situation where I ignored my own symptoms for years because I didn't even know that I should have been talking to my doctors about them. Sure enough, I had a uterus full of fibroids and ended up with a hysterectomy. And I wonder if I had raised flags about my symptoms sooner, if that wouldn't have been my fate. But there are a number of scenarios in which I go to my doctor now and say, hey, I understand that new research came out on this. What do I need to know? What do we need to talk about so I can make sure I'm on the right path to optimal health? And honestly, I notice that a lot of my doctors, their eyes light up when I come to them proactively. So I think our healthcare providers really want us to take action and want us to be, our own best advocates. And I think if you see someone who's hesitant, who doesn't get excited about that, it might be time to find a new practitioner.
Okay, that is really important stuff. Kudos to you, Megan, for owning, your own story and being brave enough to share that and then paying it forward. You're doing the work.
Thank you.
We're appreciative of you.
Thank you so much.
Megan Rabbit, thank you.